Hello, everyone.
Good day, ma'am.
I'm Esther Echegini. So in today's presentation, our interactive session, we'll be looking at most common foot problems in the elderly. And the following will be considered in today's interactive session. So as said before by my colleague, if you have any question, just write it on the chat and we will answer your question at the end of this session. Okay, we have bunion and the hammertoes, and we have nail disorders, foot pain, fractures and sprain of the ankle or muscles, plantar warts, or you can call it verruca. We have dry skin, crack toes or crack heels, diabetes, peripheral diseases also, and the corn and calluses. Bunion and hammertoes. Bunion is a bony bump that form on the joints at the base of the big toe, although sometimes it can be seen at the base of the fifth toe as well. Hammertoes are toes with abnormal bend or deformity in the middle joint. It usually affects the second and third toes. It can be presented at birth, and sometimes this can develop later in life due to different kind of conditions like arthritis or ill-fitted footwear, like people wearing high heel when they were younger. This can make them to develop foot deformities. And there are other health conditions also that can result to deformities of the toe, like claw toe, hammer toes, diabetes, autonomic neuropathy can cause foot or toe deformities. The common symptoms of you can see in people with hammer toes or bunion include the following. Some people with this will be having a kind of discomfort while walking. Some will have toe with downward bend, calluses or corns from the friction against the footwear. And this will develop most of the time on top of the toes or at the bottom of the foot, also by the side of the big toe where there is prominent bone. It could also cause pain under the big toe as well. You can see redness, swelling, and pain in the affected toes. And sometimes this can be tender, and some people will develop a kind of bruises in that area. When you have such, or when you are taking care of the elderly and you find out that this is the case, it's very important for you to contact his or her podiatrist for a routinely foot check. This will be helpful in order to avoid foot complications in the future. Hammertoes and bunion sometimes can be treated through surgery, but this is very rare, as this is done in a severe cases. We consider nail conditions. Nail problems are not usually caused by anything serious. It is common in the elderly, and you can find their nails being brittle, loosey, and sometimes the color might start changing, even the shape of the nail changing as well. And this can result just in over time without any cause. It is normal for nails also to become thick, break very easily as we get older. As I said before, change in color can be common the more we grow older, and sometimes trauma to the foot can make the toenails to fall off. And if toenails falls off, it is expected to grow back within 18 months, while the fingernails will be expected to grow back within 6 months. And the fungal nail infection is very common as well in the elderly, because the more the nails grow thicker, it's easy for infection to occur. And these nail conditions also can be a symptom of a sign or symptom of a systemic disease, because some serious or long-term conditions such as nail psoriasis, iron deficiency, anemia, and underactive thyroid or overactive thyroid can cause the nail changing in color. Diabetes also is one of them. Heart, lungs, or liver diseases can also affect the nails. Sometimes some medications also can cause changes in the nail color or shape as well. And another topic we are considering in these most common foot conditions in the elderly include foot pain. And there are different reasons for people that can cause foot pain in the elderly. Sometimes could be nail or skin problem. Ingrowing toenail will cause pain. Some kind of skin condition, infection can also cause pain. That's why it is very important for you to contact the podiatrist to check what is going on in order to avoid complications in the future. Predominantly, corn and calluses can cause pain in the elderly, along with circulation and structural problems. As we mentioned before, that structural problems can cause calluses, can also cause corn to develop, and those areas will be painful. And diabetes can also affect circulatory system, and we already discussed that the older we grow, the more prone we are to developing type 2 diabetes, so which can affect the blood circulation to the feet. Foot pain impairs mobility and the imbalance, and it is a risk factor for falls. Foot pain can be effectively managed in the elderly by the podiatrist. So always contact the podiatrist whenever there is any foot problem with the people you are taking care of or yourself. Conservative treatment can be offered: routine foot care, footwear advice, changing footwear, and sometimes there might be need to offer orthotics insole in order to accommodate or alleviate pain. Okay, this is where we stop in today's presentation, and we will now move on to question and answer session. So as we said at the beginning of this presentation, if you have any question, you can type it on the chat or you raise your hand to ask your question. Thank you.
Thank you so much, ma'am, for that insightful presentation. So please, anyone that has a question should do well to raise the hand so that we'll point the person would ask the question or drop the question on the chat. So I also have a question, ma'am. So I want to know, you say that nail conditions are common in elderly. So I want to know, can it in any circumstance happen in young adults, and what can lead to this? For it to happen in a young adult, what can lead to it?
Yes, this can also happen to the young adults, even the children. And most of the time in young adults, it could be as a result of wearing ill-fitted footwear. When it is not comfortable, when it is with a narrowed toe box, not giving enough room to accommodate the foot or the toes. And whether adults, older or younger, sometimes some people have foot deformities. So if you are wearing a kind of footwear that does not accommodate foot deformities or a kind of foot shape or foot size, if you are wearing inappropriate footwear size, or the one that is suitable for the shape or structure of your foot, it can cause pain. Like, as I said before, some people have flat foot, while some people have high arch. So this varies in individual. At the same time, depending on your activity, like some people in sports, running or footballing, those kind of activities, dancing, could also cause a kind of foot condition. Those younger ones could have what is called plantar fasciitis. They could have posterior tibial tendinitis and so many other conditions, even nail conditions such as ingrowing toenail. And this is very painful, whether the young adults or the children or the older people. There are so many things that could lead to that. So just to mention but few. Thank you. I don't know if my question was clearly answered.
Yes, it was clearly answered, ma'am. Thank you so much.
You're welcome.
Okay. Thank you so much, Ma, for the presentation. Well, I also have a question. Can you hear me?
Yes, I can hear you.
Hello.
Hi, I can hear you.
Yeah, can you hear me?
Yes, I can hear you. Yes, go ahead and ask your question. We can hear you.
Okay. Like, what are the most common causes of swollen feet, actually, because I don't really know like what are the most common causes of swollen feet. So I would like for you to just enlighten me on that, Ma. Thank you.
You're welcome. So my colleague here, Natalie, because she's a specialist in those conditions, so it will be good for her to enlighten us on that question. Thank you.
Okay. Oops. So let me just get my video on for you. Oops. Sorry. I'm just trying to get my video on. Sorry. Can you hear me?
Yeah.
Okay. Right. Need to see if you can see me now.
Not yet.
Okay.
Okay, we can see you now.
Okay, great. Okay, so oops. I'm just right. So yes, edema is very much. Sorry, my name is Natalie, and I'm with Excellent Care First Foot Health or Health. Yes, edema most definitely is one of the biggies in elderly and swelling. So there are very common causes of edema, and the most common cause of edema in elderly people would be and it's up to approximately 70% of people with elderly people with swollen lower limbs have it, and the cause is chronic venous insufficiency, and that's just when there's a problem with the veins, and that's an issue that can come about and can happen as we age. Another cause is physical inactivity and having a sedentary lifestyle. So usually you find lots of elderly people sitting with their feet in dependency, in a dependent position. So it means everything is going south, and with the inactivity and lack of the muscles activating and stimulating drainage, the fluid will just pool, and that can cause swelling in the lower limbs. Okay. Then there are other conditions that predisposes people to edema and swelling, or swelling, whichever way you want to refer to it. And that would be congestive heart failure disease, liver disease, kidney diseases, and then and lymphedema itself. And lymphedema is a condition where there's a failure of the lymphatic system. And one of the last ones that I would mention is medication. Very often in old age, we are, by the time we've reached a nice ripe old age, we're on loads of medications, we find, and often it's the medications that can cause the medications itself that we are taking to treat a particular condition that can cause the swelling. So one of the medications, common ones, are antihypertensive drugs, and it's usually the calcium channel blocking agents, because that paralyzes the lymphatic system. An example of that is amlodipine. Also, if we're on any, the hormones could also cause it, hormonal medication, and then there are also other medications like non-steroidal anti-inflammatory drugs like pioglitazone, for example, or any kind of painkillers. Over-the-counter, certain over-the-counter painkillers can also cause it. So that's just a brief and quick overview of causes of edema. I haven't gone into, generally, I haven't gone into how we would manage the edema, but I've just highlighted the causes of edema. So you're welcome to ask about that at some point as well. Okay, I hope I've answered your question, sir. Hello?
Yeah, thank you very much. Thank you very, very much.
I can't.
Okay. Yeah, thank
Okay.
you. Your answers are really, really helpful. Thank you.
Great, thanks. Okay.
Okay, thank you so much, Natalie, for that answer. We have another question from the comment section. The question said, what causes internal pain under the foot? What causes internal pain under the foot? So, ma'am.
So who'll be taking that? You or me?
I don't mind.
Okay. Esther, will you be taking that?
Yeah, that is
Okay.
fine. Okay, there are different causes of internal pain in the foot. It could be plantar fasciitis. That is when the plantar fascial muscle has been strained due to too much activities. It could be as a result of running, footballing, standing for a long time. If you are in a kind of job that keep you standing for a long time during the day, that could result in that. And also some kind of foot shape. People with flat feet, they always have this kind of condition, plantar fasciitis. And also people with high arch also do have this kind of condition. And in the elderly, the most common causes of pain in the foot is it could be as a result of painful neuropathy. That means that when there is absence of sensation, protective sensation on the feet, this can occur. There are two types of neuropathy. Non-painful neuropathy, this will not happen. But if someone have painful neuropathy, that could cause pain in the inner part of the foot. Also in the elderly, the more we grow older, the more we lose fatty pad tissue at the ball of our feet. And then when this has been lost, it causes pain to the feet. But the podiatrists are always good in handling such cases. And in the young people, there are so many other causes of pain in the foot. Depending on the kind of the pain, we determine whether it is as a result of nerve damage or due to tissue stress like muscle strain or stress. It could be tendon being affected. Sometimes it could be on the heel, and inside the heel, the person might be having pain. Depending on the type of pain also, we will be able to determine, the podiatrist will be able to determine whether it has to do with nerve or not. If some conditions like tendonitis could affect the feet and the person will be having a kind of shooting pain. Sometimes it travels from one point to another, and the tendonitis, posterior tibial tendonitis can also travel, the pain can travel also from one point to another. And if it is something like bursitis, most of the time the bursitis can be affected. It can be as a result of trauma. The trauma can occur as a result of accident. It can occur as a result of using your feet too much to do different kind of activities or standing for a long time. The that's aspects of your feet can be affected. And there are so many other things. I think my colleague Natalie here, or if anyone in the audience would like to contribute, please feel free to raise your hand to contribute to this question. Thank you.
Okay, thank you, ma'am. I don't know if there's any further contribution coming to that question, because I have one more question. Is there any further contribution coming to the last question? Okay, so let me proceed to reading out the question we have here now. I have a flat foot and I feel pain mostly in the morning when I wake up. I am between 30 to 50 years old. The pain is like as if I have a cut internal under my foot. What should I do? I don't know if we get the question.
Can you repeat the question again? Thank you.
Okay. It reads, I have a flat foot and I feel pain mostly in the morning when I wake up. I am between 30 to 50 years old. The pain is like as if I have a cut internally under my foot. What should I do?
Thank you for the question. Can you hear me? Okay, yes. Most of the time, we have to assess the patient in order to know exactly what the problem is. But with the explanation of the experience, we can relate it to plantar fasciitis. Because plantar fasciitis is a kind of, it's a condition that when you have it, early in the morning, first step will be very, very painful. The pain will be very severe, that the person will be limping. And after some hours during the day, the pain will subside. And after the activities of the day, when the person is now resting, relaxing, the pain will start up again. The most pain occurs early in the morning, first steps in the morning. And again, as I said, depending on the position, location of the pain, we determine exactly what it is. Because it could be bursitis, it could be inflammation of the fascial muscle. It could be also stress in the plantar fascial muscle. So assessing it, if it is plantar fasciitis, the pain, the location is normal, is always more painful at the medial aspect of the heel, and most of the time at the base of the big toe will be also painful. So I can't conclude what the diagnosis will be without saying it. and asking more questions about the history and other experience. I don't know if my answer is helpful, or will that person be interested in telling us more about the experience and the history of this case?
Okay, thank you so much, ma'am. So I don't know, the person who dropped the question, I don't know if the answer you got makes more sense. While we wait for that, let me drop the next question, which would be the last question that will be answered openly today. More questions can actually be dropped here in the comment section. Those other questions, we are going to look into them. And please, while dropping the question, also drop an email through which we can reach you, so that when we get the answers, we can send the answers to you on the mail, on the email address you're going to drop here. So let me go ahead and read out the next question we have here. The question says, few years back, I could stand for hours and not get tired, but recently, standing for a long period of time is now difficult sometimes. I feel pain close to my waist and under my foot. What's wrong with me and what can I do? You get the question, ma'am?
I would like my colleague Natalie to help us with the question, with the answer. Thank you.
Okay, Natalie, please. Natalie, are you online?
Hi, yes, I am here. I'm just trying to get. Oh, okay. Can you see me now?
Yes. Should I repeat the question or did you get it?
Yes, could you please repeat the question?
Okay.
Is it a falls related question? Sorry.
Yes, it is.
Okay.
So the question says, few years back, I could stand for hours and not get tired. But recently, standing for a long period of time is now difficult. Sometimes I feel pain close to my waist and under my foot. What's wrong with me and what can I do?
So, okay, fine. Firstly, I'm not quite sure, why you would feel it close to your waist. There might be a bigger belly there. You might be carrying excess weight. So that's a possibility. But when we get in, we'll move closer down to the foot. So standing, not being able to stand for long periods of time, the legs could get tired, and it could possibly be related to swelling, because there could be an ache, there could be some muscle atrophy, so loss of muscle bulk. It might just be excess weight. So if you're carrying excess weight, it's and all of that pressure and strain goes down to the feet, down the legs and to the feet. Yes, that could be the cause. There could be an underlying foot pathology, so that needs to be explored a bit more. That's my understanding of the question. I didn't really think that it was related to falling, but rather the inability to be to stand for a long period of time. Is that correct? Was my understanding of the question correct then?
Yes,
or my
yes,
interpretation
ma'am.
of?
Yes.
Okay. Rather than falls related, because that was the question that I had asked. But anyway, okay, yeah. So what's wrong with the foot? That was the question as well. What's wrong with you and what can you do? There is no definitive answer, I would say, because it might need further, like I said, it could be a specific foot pathology. It might need further investigation in the form of an X-ray, ultrasound, MRI scan, whatever, to check for either a bony issue or a soft tissue injury or some kind of trauma of some sort. If it is related to a specific foot pathology, like I said, that's one. Two, extra weight, it might just be old age as well. So there are a number of variables and things to consider. So what you can do, I wouldn't be able to answer that until further investigation is undertaken. And that would also answer what the question was, what is wrong with you? Okay.
Good.
Okay. I hope that's answered your question then.
Thank you so much, Natalie.
Okay.
I'm going to take the last question for today.
Sorry, I just wanted to add just a little thing to the last question, which my colleague has really broken down. It's just a little thing to add to that. Sometimes, although we don't know exactly what the diagnosis could be, but sometimes the pain near the hip or waist could be as a result of nerve damage, depending on exactly the type of nerve that is being affected. And sometimes it could be related to what is called leg length discrepancy, when the length of legs are not equal. So if you have such problem and visit the podiatrist will be able to assess and know what exactly your problem could be. Because if one leg is longer than another, it means that you will be compensating, you will be trying to use one side of your body more than the other side. Some people have this case, leg length discrepancy, unequal leg length. And so most of the time, they don't realize that this is the case, and they will be putting their weight in one side in order to compensate the part of the body that is not as long as the other part. And if this goes on after a long time in life, that part of the body that is being overweight will start having pain, mostly at the hip. So when you come to the podiatrist, if this is the case, we always prescribe insole to help with this, and it's always helpful, and the result is always great. So if you have this kind of case, go and see your podiatrist. There will be help.
Okay.
Thank you.
Okay. Esther,
Yeah.
sorry, just to add. So I've noticed there's another question in the box, in the chat box, about how we can prevent falls in the elderly. So yes, I'm happy to take that question. If you, yeah, okay. So to answer that question, how we can prevent falls in the elderly, we can first. I'll start to first by talking about what causes a fall, or what are the common causes of falls in the elderly, and then addressing those causes. Okay, so I mean, anybody can have a fall, and lots of people do have falls, myself included. So I just had one just the other day. But I was going to say approximately, 1 in 3 people, a third of over 65-year-olds have falls, and this increases, up to a half in 80-year-olds. So it's it is a common problem in the elderly. So, and especially if they have a long-term condition as well. So that can, predispose them to falling. So then how would you prevent that? Is you manage the condition, okay, whatever the long-term condition. So you optimize your management of that condition. Another cause would be balance issues, or issues with the vision, poor vision, which often elderly people have both of. So in terms of balance issues, so you try and get them some kind of aid, or walking aid that will assist with their balance or their mobilization or their mobility. And likewise, if the problem or the cause is poor vision, so you address their eyesight and make sure they have sort of eye tests regularly. And these are ways that you can address it. Again, I mentioned long-term disease, so long or chronic diseases, so it could be heart diseases, because you can have swelling, or and that could cause some kind of imbalance or heaviness when people have to walk, because the increased swelling does cause some kind of heaviness and an ache in the legs. Dementia, if there's some kind of confusion that that could contribute to people falling. Then also lighting. You have to consider lighting, whether the lighting is adequate enough. Sometimes if the lighting is muted, people struggle to see where they're walking. And although sometimes the lighting may not even be muted, but it just, for elderly people with eyesight problems, again, it ties in. So it's addressing those problems and how you're going to address those problems. Then also things like just practical things. Think in terms of common sense, like rugs and carpets, whether they loose fitting, they can cause slips or trips. Making sure therefore that the carpets are in place, and they won't slip and cause people to fall. And then another thing that we sometimes overlook is storage. So if people have to reach up, higher up for something, and they have to struggle to get there, then it will also impact and cause people to fall or lose their balance and fall. Just going back again to long-term and chronic conditions, long-term health conditions, neurological conditions is something that also comes to mind in terms of Parkinson's disease, and people who've had strokes. So where the gait or mobilizing or mobility is a bit of an issue, because particularly say in Parkinson's disease, you have a sort of festinated gait, and people struggle. And there again, flooring and carpeting is an issue that has to be considered as well. And the other long-term condition that I said is with stroke. So there could be weakness, muscle weakness, in the possibly on one side of the body. It depends on how much the stroke has affected the individual. Then also medications, again, coming back to medications. We're taking medications to help, but sometimes medications can make people feel a bit drowsy, or there could be other side effects like balance issues and things like that. So I've spoken about the causes, but to answer your question is, if we address the causes, that's one way of preventing the falls. So I hope that's answered your question adequately or sufficiently.
All right. Thank you so much, Natalie, for that answer you've given us. So like I dropped on the comment section, if you have further questions, please do well to drop it here, and we are going to, and also your email, so we'll be able to send you the answers to your questions via your email. Also, there is an email there. You can also drop the questions in those email, and we are going to definitely send you replies to those questions. Before we draw the curtain here today, I would ask Madam Esther, I don't know if you have any final words to leave for us before we draw the curtain.
Hi, everyone. I just want to use this opportunity on behalf of our excellent care team to thank every one of us who has been present in today's interactive session. Yeah, thank you for coming, and we hope to see you tomorrow in tomorrow's session that will be on diabetes and peripheral diseases. Thank you, and see you tomorrow and next week, Tuesday and Wednesday. Bye.
Bye-bye.
Thank you so much, Mom. Natalie,
Bye.
any final words?
No, I think Esther was quite articulate there and has spoken on behalf of both of us. Thank you, Esther. She's covered everything.
Right.
And thanks. I enjoyed today's session, and I hope to see everybody again next
Thank
week.
you so much.
Thank you.
Thank you so much,
too.
ma'am.
Good job.
Yeah, so everyone, we have another presentation here tomorrow by 2 p.m. UK time. It's going to be on diabetes and peripheral diseases, okay? So let's also do well to be present here tomorrow. And please do invite as many persons as you can, so that we'll have a very interesting interactive session tomorrow. Come with your questions, any question you have on diabetes and peripheral diseases, okay? I believe that our team will be able to do justice to that tomorrow. And then we're going to meet again next week, Tuesday and Wednesday too. As we meet, the topics of our discussions will keep unfolding. So I wish that we all have a pleasant day ahead. Thank you so much for being part of this program.